Are you taking medications for sleep, allergies, bladder control, or anxiety? If you're over 60, there's something critically important you need to know. Some very common medications, ones that might be sitting in your medicine cabinet right now, could be increasing your risk of memory problems and dementia by up to 50%. Hello, and welcome back to our channel focused on healthy aging. I'm here today to discuss a serious concern that affects millions of seniors, how certain everyday medications might be silently affecting your brain health. This isn't about rare or experimental drugs. These are medications you can buy at any pharmacy, medications your doctor might have prescribed for common age-related issues. But here's what many people don't know. Taking these drugs daily for just 1 year can significantly increase your dementia risk. If you have family members or friends who might be taking these medications, please share this video with them. Knowledge is power when it comes to protecting your brain health as you age. The medications I'm talking about belong to a class called anticholinergics. Don't worry about the fancy name. What matters is what they do to your brain. These drugs block a crucial brain chemical called acetylcholine. Think of acetylcholine as your brain's communication system. It helps your brain cells talk to each other, helps you remember things, stay focused, and even control your muscles. When you take anticholinergic drugs regularly, it's like putting static on your brain's radio station. Over time, the signals get weaker and weaker, leading to memory problems and potentially dementia. Here's why this is especially concerning for seniors. As we naturally age, our acetylcholine levels already start to decline. When you add these medications on top of that natural decline, you're essentially accelerating the process. So, which medications am I talking about? You might be surprised. For sleep problems, Benadryl, diphenhydramine, Tylenol PM, Unisom, many over-the-counter PM medications. For allergies, Benadryl, yes, the same one, older antihistamines. For anxiety, hydroxyzine, also called Vistarel or Atarax. For bladder control, Ditrol or DTRLA, Ditropan, Vicicare, oxybutynin. For digestive issues, Bentol for IBS. Motion sickness patches. Other common ones. Some muscle relaxants, certain antidepressants, and some medications for nausea. Now, you might be thinking, surely these can't be that dangerous if they're so common. Unfortunately, the research tells a different story. A major study of over 1.5 million people found that anticholinergic drugs independently increase the risk of dementia and Alzheimer's disease. The more you use these drugs, the higher your risk. Another study of 21 research projects found that using these medications for just 3 months increased dementia risk by 46% compared to people who didn't use them. But here's what's really concerning. Brain imaging studies show these drugs actually cause brain shrinkage and affect how your brain functions. This isn't just about feeling groggy. These medications can physically change your brain. If you're over 60, you're at particular risk for several reasons. Natural aging, your acetylcholine levels are already declining naturally. Multiple medications. Seniors often take several medications, and some people unknowingly take multiple anticholinergic drugs. Slower metabolism. Your body processes medications differently as you age. Existing health conditions. You may already have risk factors for cognitive decline. I see this combination frequently. Someone might take hydroxyzine for anxiety, Benadryl for sleep, and Ditropan for bladder control. Each drug blocks some acetylcholine, but together they can significantly impact brain function. What should you do? First, and this is crucial, do not stop any medications without talking to your doctor first. Stopping some medications suddenly can be dangerous. Here's your action plan. Step 1. Take inventory. Go through all your medications, prescription and over-the-counter, Include vitamins and supplements. Ask your pharmacist or search online to see which ones are anticholinergic. Step 2. Talk to your doctor. Bring your complete medication list to your next appointment. Ask specifically about anticholinergic medications. Discuss safer alternatives, especially for long-term use. Step 3. Know the safer alternatives. For sleep problems, consider melatonin. Start with low doses. Magnesium glycinate, chamomile tea. Prescription options like travazone, which has minimal anticholinergic effects. For allergies, newer antihistamines like Zyrtec or Claritin or Allegra. These have less impact on the brain than older antihistamines. For anxiety, ask about a newer medication like buspirone. For bladder control, ask about Myrbetriq, which works differently than anticholinergic drugs. Pelvic floor exercises, behavioral techniques. For digestive issues, peppermint oil for IBS. Dietary changes, other prescription options your doctor might recommend. If you're already taking these medications long-term, don't panic. The brain has remarkable ability to recover when given the chance. Higher-risk seniors should be especially careful. Anyone over 75, people already experiencing memory concerns, those taking multiple anticholinergic medications, people with family history of dementia. Short-term use is different. Taking Benadryl for a couple of nights for a severe allergy reaction is very different than taking it every night for months. While you're working with your doctor on medication alternatives, you can start protecting your brain health right now. Physical activity. Regular exercise is one of the best things you can do for brain health. Even a 30-minute walk most days makes a difference. Quality sleep. Work on sleep hygiene. Consistent bedtime, cool room, no screens before bed. Manage other risk factors. Keep your blood pressure controlled. Manage diabetes if you have it. Stay socially connected. Challenge your brain with new activities. Nutrition. A Mediterranean-style diet rich in vegetables, fish, and healthy fats supports brain health. Remember, the goal isn't to scare you away from all medications. It's to help you make informed decisions about your health. Many conditions require medication, and the benefits often outweigh the risks when used appropriately and for the right duration. The key is awareness and communication with your healthcare team. You have the right to understand what medications you're taking and if there might be safer alternatives for long-term use. Your brain health is worth protecting, and small changes now can make a big difference in maintaining your memory and independence as you age. If this video was helpful, please give it a thumbs up and share it with anyone who might benefit from this information. Have you or a family member had experience with these medications? Share your story in the comments below. Your experience might help others. Subscribe to our channel for more content focused on healthy aging and ring the notification bell so you don't miss our upcoming videos on brain health optimization. Until next time, stay healthy and keep taking care of your amazing brain.